Well, we are on your side today with more information about hepatitis C, and Dr. Michael Passarella and nurse practitioner Tameria Williams join us from Shelby Baptist Medical Center with some potentially life-saving information. Thank you both for being with us today.
Thank you.
So tell us a little bit about who needs to get tested for hepatitis C.
Well, anyone that is born between the years of 1945 to 1965, considered the baby boomers, the CDC has recommended starting in 2012 that those individuals definitely receive a one-time hepatitis C antibody screening, just because rates are higher in that age bracket than any other compared to other ages. But certainly anyone can be affected with hepatitis C. So if there are any concerns that they may have been exposed to the hepatitis C virus, any potential history of IV drug use or sharing of needles, anyone born to a mother with hepatitis C, anyone that's been on long-term hemodialysis, those are individuals that would definitely be screened. Or if anyone has concerns, certainly they can discuss that with their provider and they can determine if they need to be tested for it.
And those ages, it's mainly because blood was not screened as well during that time, is that correct?
Absolutely. The hepatitis C virus was not actually formally named until 1989.
Okay.
And so there was not universal screening of the blood supply prior to that. So anyone who may have received blood products before 1992 that could have received blood that was infected with the hepatitis C virus, certainly.
Yes, and Dr. Passarella, what are some of the symptoms of someone who has hepatitis C? What should they be looking for, possibly?
Well, that's the tricky thing with hepatitis C and why we stress screening, which when we mention screening, we mean it's a test more times than not is done when you don't have any symptoms.
Okay.
And hepatitis C often, and more times than not, doesn't really have any symptoms necessarily, and so you can be infected and not realize it. And there are some cases in which people might feel like they have a virus or a cold and some of the common ailments that go along with those issues. But generally speaking, though, you're probably not going to be aware that you have hepatitis C, and that's why we recommend going to talk to your provider to see if you kind of fit any of those categories that Tam mentions about getting the screening test to see if you do test positive and might warrant treatment or therapy.
And I understand that there are some treatments. Talk about those a little bit.
Absolutely. There are several treatments out there now that are available for hepatitis C. The treatments are very tolerable with minimal to no side effects. Your treatment regimen can range anywhere from 8 to 12 weeks. And so there have been great strides in the hepatitis C community that we're so proud of, that prior treatments were longer duration, side effects were very harsh. And so, there are various treatments out there. You see the commercials, there's Harvoni, Epclusa, but there are several other treatments out there that are available. It just depends on the patient and their overall clinical picture when determining what's the best treatment option for them.
And they can talk to their provider about that as well.
Absolutely.
Well, we appreciate both of you being here today. Thank you so much for bringing this important information for our viewers.